I want to talk about autoimmune diseases today. This is a group of diseases that when your doctor really doesn't know what your basic problem is, he's tried treating you with protocol A and B and C and nothing's happening, getting worse, he's going to call it an autoimmune disease. Your body's attacking itself, therefore taking the blame away from him for not knowing, right? And when you're looking at fibromyalgia, sarcoidosis, lupus, rheumatoid arthritis, doctors will call all of these things a autoimmune disorder because they really don't know the cause. Well, the basic underlying cause is a gluten intolerance where the intestinal lining is severely damaged to the point where you may only be getting 3 to 5% absorption. You've lost 95 to 97% of the absorptive surface, and it really doesn't look good. I mean, if you look at it under the microscope, your intestines look like you've been eating poison ivy for salad. It is ugly, okay? Now, rheumatoid arthritis has a little different aspect. It's also involved with gluten intolerance, but it's really, when you really look at the basic problem here, it's bone-to-bone arthritis, and the autoimmune piece, where you get the RA factor, where they do a blood test, has to do with an infection, a secondary infection on top of the bone-to-bone arthritis, and it's an infection with a bug called mycoplasma, which is a respiratory bug, easily killed in 2 weeks with an antibiotic called minocycline, like the little bait fish minocycline, which is a member of the tetracycline family. I can kill that mycoplasma bug in 2 weeks with minocycline, just like I can kill the syphilis bug in 2 weeks with penicillin. There's no doubt about that. But then you have to give your genes, your DNA, your RNA, and your telomeres all the raw materials they need to restructure and maintain and rebuild and repair. Okay? So I want you to get a hold of the books, Dead Doctors Don't Lie, the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earths Forbidden Cures, and the CD called Serial Killers. It's a contraction of two words, serial, such as eating cereal, and serial killers, just like the people who kill somebody a couple of times a week, okay? And so we've contracted down to CERIAL, Serial Killers, and you want to listen to that CD, read these sections that are appropriate in the books Dead Doctors Don't Lie, Epigenetics, and Rare Earths Forbidden Cures. And you'll just shake your head and say, oh my gosh, it can't be that simple. It cannot be that simple, but it is. So what you need to do is, this goes by body weight. You want to take the 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. Stay away from all the inflammatory things. We're talking about fried foods, processed meats, deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam. You stay away from oils. I mean, we're talking about microwave popcorn, theater popcorn, olive oil, coconut oil, margarines, mayonnaise, salad dressing, cooking oils, and absolutely no gluten, no wheat, no barley, rye, and oats. And watch what happens. And usually when people have these autoimmune diseases, they're also going to have skin problems. They're going to have eczema, dermatitis, psoriasis, rosacea, and they might also have some respiratory problems, asthma, bronchitis. They might have constipation and diarrhea. And this whole complex kind of runs together, which is a loud and clear signal that you have a gluten intolerance. Stay away from gluten. Take the 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and watch what happens. Your body wants to heal itself. You have genes, DNA, RNA, and telomeres, which have the capacity to maintain and repair you. That's what they do. But they cannot do that without raw materials. That's why you must supplement, and you also must make sure you have a high efficiency of absorption. That old adage, you are what you eat, is not true. You are what you absorb. So getting gluten-free when you have these autoimmune diseases, and then you take the 90 essential nutrients, watch what happens. And, of course, rheumatoid arthritis, you want to get a hold of that minocycline from your doctor if they won't give it to you. I actually have an herb blend called Killer Biotic, 8 herbs, which support the immune system. 2 of those 8 herbs actually have antimicrobial properties. And you can actually go to Mexico without a prescription, buy a year's supply of the minocycline, same exact drug, same manufacturer in the United States, for like 1/100th the cost. And you have fun down in Cancun, right? So again, get the books Dead Doctors Don't Lie, the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earths Forbidden Cures. Have a family meeting. Everybody needs to listen to that Serial Killers CD together, ask and answer questions, and you should have a family meeting on this health thing like once a week. But if that's too complicated because everybody lives all over the place, do it certainly once every 2 weeks, and do it by Skype. You can do it by telephone conferencing and so forth. This is a serious problem. the government and the medical system says our kids will be the first generation of Americans who do not live as long as their parents. And so isn't it worth spending more time dealing with this than it is watching another hockey game on TV? Now, doctors will say, oh, don't worry about supplementation. Just eat good food and you'll get everything you need. Well, that's like saying, don't put oil in your car. Just put 6 quarts of dirt from Texas in there, because everybody knows there's a lot of oil in Texas. And why would you want to spend $12 every 3,000 miles to renew your oil when you can spend 25 cents a quart for this Texas dirt? And since it's Texas dirt, there's bound to be some oil in there. Well, that's the same thing as doctors say, oh, don't worry about supplementation. Just eat well. You're going to get everything you need, because, you're going to have everything you need in your food if you're eating well. That's nonsense. Do not believe that. And that's where the book Rare Earths and Cures comes in. It goes into the history, why our soils are dead, and what you can do about it. Oh, yeah. Supplement with the 90, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and give your genes, DNA, RNA, and telomeres what they need to maintain and repair you. We'll be back with Dead Doctors Don't Lie after these messages. Okay, let's see here. Doug, what pearls of wisdom do you have for us?
I thought we'd talk about pregnancy. As remember, we had a story a while back where they had done a study in the UK and found that women who ate diets of high fat and sugar often ended up with kids with ADHD. Well, we have a similar, it's actually, I believe, from the same study. We have a story from ABC News headlined, Acetaminophen use during pregnancy linked to childhood behavioral problems. Study finds. This was all published in the Journal American Medical Association Pediatrics. They say the common over-the-counter pain medication has been associated with increased risk of developing behavioral issues for children who are exposed to the drug in utero. And they say children were more likely to exhibit behavioral issues such as hyperactivity if the mother took acetaminophen while pregnant, by researchers from multiple institutions, including the University of Bristol. And they say acetaminophen is a common pain reliever and fever reducer found in brands such as Tylenol. Expectant mothers have been told for years that reaching for the drug to treat pain during pregnancy is safe. Well, it sounds to me like another failed medical theory. As they say, Dr. Evie Sturgiakuli, a lead author on this study, a researcher of genetic epidemiology and statistical genetics at the University of Bristol, said the study aimed to control other variables such as genetic, familial, social factors so that researchers could get a better understanding of whether there's a link between the drug and behavioral conditions. And she says that we have evidence that acetaminophen use during pregnancy has a biological mechanism of action in regard to increasing behavioral issues during childhood. However, the overall effect was small. As said that it shouldn't cause women to panic and stop taking the drug. And it's always funny, whenever they find out a drug has a problem, they always have to add that in. Well, that doesn't mean you got to stop taking it. They looked at almost 8,000 women here were living in Bristol, surveyed the women for 7 years about their child's behavior, and found that compared to women who did not take the drug during pregnancy, acetaminophen was associated with a variety of behavioral issues. Use of acetaminophen during pregnancy had a 42% increase of conduct problems, 31% increased risk of hyperactivity disorders, and a 29% increased risk of emotional problems in children. So there you go. Yet another reason to stay away from the drugs.
Oh, absolutely. As you point out, they always say, oh, yeah, you got an average of 30% increase in risk of getting these emotional problems in the kids. And you're saying, don't worry about it. Go ahead and take the drugs anyway. What a dumb thing, of course. And you have to ask, okay, why are these women taking all these painkillers? They have back problems, they have knee problems, hip problems, neck problems. And that's because they're not getting enough raw materials for themselves, let alone for themselves and an embryo. And so here's a case where you can use topical pain relievers such as the CM cream and trauma oil, but what you have to do, of course, is take the 90 essential nutrients prior to conception, all through the pregnancy. Then when the baby's born, if you're breastfeeding, that's fine, but if you're not breastfeeding, the baby needs to get their own set of the 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and this will give the body what it needs to function properly. This is the problem. All of these behavioral problems, ADD, ADHD, autism, depression, manic depression, bipolar disease, PTSD, anxiety attacks, panic attacks, schizophrenia, psychoses, every one of these things is caused by nutritional deficiencies of the brain. The psychologists and psychiatrists will say, oh, these represent a chemical imbalance of the brain. Well, that's right. a chemical imbalance is caused by a nutritional deficiency or multiples of nutritional deficiencies. So my advice is, if you're in the childbearing years, you better be taking the 90 essential nutrients. If you get pregnant, then the embryo will be safe. Stay away from the bad foods, fried foods, processed meats, oils, and gluten. And listen to the CD, Serial Killers, Get Off of Gluten. Read the book, Dead Dogs Don't Lie, Epigenetics, and Rare Earths Been Cures, and let's have healthy babies. Thank you, Doug. Super job as usual. We'll be back with Dead Doctors Don't Lie after these messages. All right, Doug, let's go to callers.
All right, let's head to New Zealand. And Bev, you're on with Dr. Wallach.
Oh, Bev, you're on the air.
Hi, good morning, Dr. Wallach. I am 176 centimetres in height. I weigh 65 kilos, and I have quite a bit going on in my body. I've just found out about longevity and I'm on some of the products, but I'm taking what it said on the bottle, the amount on the bottle. I'm not sure if I'm taking the right amounts of everything for what I've got going on in my body.
So it's your, what did you say, 63 kilos?
65 kilos. I'm 176.
Yeah, 156 pounds. Okay. Right?
I don't know what that is in pounds, but I'm 65 kilos in weight.
Okay. Now, do you have any history of asthma, bronchitis?
No.
Do you have any history of skin problems, eczema, dermatitis, psoriasis?
No.
Okay, and so what are your major complaints? I kind of missed that on the front end.
Oh, sorry. I was born with bad hips. I have lower back pain. I have sore knee and thumb on my left side. I have a really bad memory, receding gums, really wrinkled face. I have poor eyesight. I have no interest in intimacy. I have a leaky bladder. I have numb, tingling arms, very itchy ears. I have a lump under my right armpit and a lump at the very top of the inside of my right leg, and I have just developed a varicose vein.
Okay, so when you have these lumps, have you been to a doctor about the lumps?
No, I haven't.
Okay. I start out with somebody non-invasive. I start out with a naturopathic doctor or a chiropractor, somebody, have them look at those lumps and see if it's a lymph node or an abscess or what it might be. Receding gums is actually caused by osteoporosis of the face. Doctors forget to tell you can get osteoporosis of all the skull and facial bones and jaw bones too. And you have a back problem, you got knee problems, receding gums, leaky bladder. You have a lower back problem, and that will actually compress the roots of the spinal nerves coming out from between the lumbar vertebrae, which control the bladder. So when people have leaky bladder, they have incontinence, they have pain on urination or burning on urination, they get up 10 times a night. If you're a woman, it's certainly not a prostate problem. It's a back problem. And then varicose veins is a mineral deficiency because of a breakdown of the elastic fibers in the vein walls. The itchy ears, see what I was looking for when I was asking about eczema and dermatitis. Well, hang on, we'll come back and I will give you what I think could help you after these messages. Okay, Doug, let's go right back to our Kiwi friends in New Zealand. And Bev, at 156 pounds, what I want you to do is get rid of all the inflammatory stuff. No fried foods. Absolutely no processed meats with nitrates and nitrites. No deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam. Absolutely no oils. It means no microwave popcorn, no theater popcorn. Absolutely no olive oil, no coconut oil, no margarines, mayonnaise, celery, and cooking oils. If you eat canned fish like tuna or sardines, you need to get them packed in water, not oil. And then no gluten, no wheat, no barley, or no rye, no oats. And then at 156 pounds, I'd have you take what we call 2 of the Healthy Brain and Heart Packs per month. The purpose here is to give yourself all 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. I would also throw in the glucogel, and this is designed to support your genes, your DNA, your RNA, and your telomeres in their efforts to support maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, and that would require 2 bottles a month of that. So it'll be 2 Healthy Brain and Heart Packs, 2 bottles of glucogel, and this will support maintenance repair when you have any kind of musculoskeletal problems, either the direct results or secondary results like leaky bladder syndrome and so forth. Okay, Doug, let's go to callers.
All right, let's head to Minnesota. And Jack, you're on with Dr. Wallach.
Oh, Jack, you're on the air.
Hey, Dr. Wallach, I called you last week, and I got the final MRI results on that complex cyst near the bile duct on the liver.
Okay.
It has the findings and it has an impression. I don't know which one you'd like to hear.
Just start.
All right, the findings: the liver is normal in size and shape. Mildly dilated bile ducts in the left hepatic lobe are demonstrated along with what appears to be roughly a 2 by 2 by 1.6 centimeter mass in the region of the left hepatic duct. The appearance raises concern of cholangiocarcinoma, and the signal of the liver peritoneumia and contrast enhancement in the region of the dilated ducts is somewhat different from the remaining liver peritoneumia. The mass noted is suspected to be compressing the left portal vein. The main portal vein is patent and demonstrates no filling defect. No portosystemic collateral vein is evident. Several liver cysts are demonstrated. The spleen is negative. No ascites demonstrated. And I've been on your Z-radical, selenium, tangy, tablets, and minerals for about 3 weeks to try to shrink the mass. His impression is that the mass in the region of the left hepatic duct apparently obstructing the duct and compressing the left hepatic vein. Findings raise concern of a cholangiocarcinoma. ERCP or CT-MRCP is recommended.
So he's believing that it's a carcinoma. He's believing it's cancer, right?
He's saying there's a possibility.
Okay, so hang on. We'll be back. We'll give you some recommendations, Jack, after these messages. Okay, Doug, let's go right back to Minnesota. And Jack, what do you weigh, sir?
150 pounds.
150 pounds, okay. All right. So we don't yet know what it is, but there's a suspicion by the guy who interpreted the CAT scans, X-rays, so forth. He's interpreted it as a mass. Could be a carcinoma, which is another name for a type of cancer. And so basically what we want to do is, at the very least, we want to, until we know for sure, we can stop the ongoing damage. We can stop the driving of the cancer by getting rid of the inflammatory foods in your diet, no fried foods, no processed meats with nitrates and nitrites, no oils and no gluten, wheat, brown, and oats. Get rid of those things. This will be forever, not just for 2 weeks. Also, you want to support your immune system. And so at 150 pounds, I would have you take all 90 essential nutrients to support the immune system for any reason, right? But in this case, we're going to support the immune system, make your genes, DNA, RNA, and telomeres happy. Take the 2 Healthy Brain and Heart Packs per month, a full dose of everything at breakfast and dinner. That'll be 3 of our selenium capsules at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the BTT 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner, all that be accomplished by the 2 Healthy Brain and Heart Packs per month. I would also throw in the Z-radical. It contains fucoidan, a substance that comes from the red marine algae, really supports the immune system, credited as one of the reasons why the Japanese suffer less cancer than we do and have higher rates of survivors. Okay, so I'd have you take the 2 ounces a day of the Z-radical. It's 1 ounce at breakfast, 1 ounce at dinner time. That's 2 quarts a month. And lastly, I get your ORIC points, your oxygen radical absorption capacity points above 300,000 a day. And again, this is to support your immune system, to fend off stuff you don't like and don't want. And that'll get you over 320,000 ORIC points a day. And let's see here. I would take 3 or 4 of the Beyond Tangerine 2.0 tablets, which is different from the BTT 2.0 crystals that are in your Healthy Brain and Heart packs. And I would go ahead and take 3 or 4 of those tablets twice a day. That'll be 2 bottles a month, and that's going to support your immune system. And, of course, you could, once in a while, you could throw in 6 a day of the Triple Treat chocolate. That'll get you up over 100,000 ORAC points right there, again, to support the immune system anytime you have some serious problem. And give us a call every couple of weeks. Let us know how you're feeling, how you're doing. Give us a call when you get more assessments or what the doctors decide they want to do, or if they get a more complete diagnosis, we can tweak things and be more specific. Okay, Doug, let's go to callers.
All right, let's head to Cincinnati, Ohio, and Bellamy. You're on with Dr. Wallach.
Well, Bellamy, you're on the air.
Hi, Doc.
Hi.
Today I've got a question about eye health. I've got a 13-year-old boy that's been diagnosed with acetropia in the right eye. So I wanted to know if there's anything that can be done for that.
Okay, and now did you say acetropia?
Yes, ESOTROPIA.
Okay, and how's it manifesting itself in the kid?
The eye, droops to the middle. I think that's what the doctor said.
Okay, so it's
like
a
lazy eye.
Lazy eye kind of thing? Okay.
Yeah, that goes to the middle.
Okay, was he with this, or did that sort of develop as time went on?
I think just as time went on, this is a new diagnosis.
Okay, and how much does the kid weigh, you think?
I think about 135, maybe 135, 145.
Okay, is he tall?
Let's see. I think he's about 5'4", so not too tall.
All right. Well, does the kid have any history of eczema, dermatitis, or psoriasis?
No.
Any history of asthma?
No.
Any history of bowel problems, constipation, diarrhea, anything like that?
No.
Okay. Well, anytime you have anything going on with the eye, you have to think of it as part of the brain. Even the muscles that control, your eye movement and how the eye looks when you're just you think you're looking straight ahead. Are you crossing your eyes consciously or unconsciously? And so what I would do is get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten. Even if there's no overt signs of gluten intolerance, I would still, just for maximum absorption, I get him off of all gluten. No wheat, barley, rye, or oats, no fried foods, no processed meats, no oils. And then at 135 pounds, I'd have him take 1 Healthy Brain and Heart pack per month, throw in an extra bottle of selenium so he could take 6 of those a day, 2 at breakfast, 2 at lunch, 2 at dinner time. I'd also have him take 2 Occutive tablets a day, 1 at breakfast, 1 at dinner. That'll be 2 bottles a month because they come 30 in a bottle. Occutive. And let's see here. I would also have him take the Vision FX. Vision FX, I'd have him take 3 of those twice a day. It's 2 bottles a month. And then call me every couple of weeks. Call me every time the kid goes into the eye doctor and gets some assessment. Is it staying the same? Is it getting better? Is it getting worse? Are there other things showing up? Or is it just this one problem? So let's kind of look at that on a regular basis and keep me apprised of any new assessments by the eye doctor, and we'll kind of help you guys navigate through this. Okay, Doug, let's go to a caller.
All right, let's head to California. And Jose, you're on with Dr. Wallach.
Jose, how can we help you, sir?
Hi, I am a 33-year-old male, 5'6" inches, 163 pounds. And recently I started having pain, severe pain in the joints and muscle spasms, a lot of pain in the neck, shoulder, and knees, a lot of fatigue. I get really sleepy after eating, and at night I cannot really sleep. I wake up every hour. I also get numbness in my body, and I sweat a lot, especially during the night. And I have my body temperature varies a lot. I usually have cold feet in my hands and my back, and I constantly get really thirsty and dehydrated.
Okay. Have you ever been tested for diabetes?
No.
Okay. I'd urge you to go to a pharmacy and get some of those test strips that diabetics use to test their blood on a regular basis. You don't need a prescription. You just go there and get a bottle of 5 and take your fasting blood sugar, before you eat in the morning. Just don't eat. Stick yourself in the finger. Follow the directions on the bottle. You don't need a machine because they usually have a rainbow of colors, and you match up the color on the test strip after the incubation period they tell you about on the bottle and so forth. And it'll tell you how many milligrams of sugar is in your blood, and you can determine yourself whether you have diabetes or not. But getting sleepy after meals can usually be called reactive hypoglycemia or low blood sugar. It can be called hyperglycemia or narcolepsy. Okay, cold feet and hands could be due to, again, compression of the spinal nerves to actually control the hands and feet. And let's see here, pain in the neck and back and muscles and so forth would be maybe called fibromyalgia, sarcoidosis. It could be called many things, just arthritis. And so what I would do is hang on. I will be back and get your pen and paper ready. I will line out for you what I think you should take to deal with all these musculoskeletal problems and sleep problems after these messages. Back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 Life Crusade. And let's see here, Doug, let's go back to California and Jose. Okay, Shar, are you there?
I'm here.
Okay, here we have Jose, 33-year-old guy, 5'6", 163 pounds. He falls asleep after he eats. He's thirsty. Okay, so he's got a blood sugar problem. And then also he's got pain. He's got pain in his muscle and his joints and so forth, so he's got a musculoskeletal problem. What would you give a 163-year-old person with musculoskeletal problems and blood sugar problems?
Personally, I would give him one healthy blood sugar pack, and I'd give him one healthy bone and joint pack. That would cover everything.
Yeah, and I also get him another bottle of the glucogel, so he could take a total of 15 a day of the glucogel. One comes with the healthy bone and joint pack. And what would you do for the blood sugar problem?
Well, the Sweeties comes in the healthy blood sugar pack, but he could get an extra bottle too and take it.
He could take 6 a day.
Yep.
2 and 2 or 3 and 3. And he's got to stay away from all the bad foods: no fried foods, no processed meats, no oils, no gluten, and no sugar. Okay, no carbonated drinks. And this is forever. He's got a lot of things going on here, and the odds of him having a gluten problem is very high. That's why he has so many different diseases here. They're all nutritional deficiency problems, and so we got to work from both ends. We got to stop the ongoing damage. We have to increase his absorption, and we have to make the nutrients, 60 nutrients, so 16 minerals, 16 vitamins, 12 minerals, and 3 fatty acids available for his genes, DNA, RNA, and telomeres. They are blueprints. They want to maintain and repair people, but they need the raw materials to get her done. So call us every couple of weeks, Jose. Let us know what you weigh. Let us know your symptom list, and you do need to test your blood sugar and all that kind of stuff. Do that yourself. Just run to the pharmacy and get those test strips. Let us know what you find on fasting blood sugars. And if you get sleepy, you might, an hour or a half hour after you eat, I'd go ahead and test your blood sugar again. You're going to test in the morning before you eat, okay, to get your fasting blood sugar. But then I would get it when you're getting drowsy after you eat. If you need some help, get somebody else to help you. But you need to test it then. And you'll see a significant difference. It could be 40, 50, 60, 70, 100 points difference. Okay, and that'll give us some sense of how intense this problem is. Okay, let's see here. How much time we got here, Doug?
You got just under 2 minutes.
Just under 2 minutes. Okay. I'm going to take this with Char since she was absent for a few moments there. Charmaine?
Yes.
Now, we're seeing more and more and more people who are 50 to 100 pounds overweight. And what do you attribute to this? Do you attribute that to lack of exercise and eating too much?
No, I know what it's for. I know what it's caused from, because when your body doesn't get the minerals and the nutrition that it has to have, specifically minerals, it is clamoring for minerals, and people take that to mean eat food, and they eat whatever's handy. And I was never overweight, but I had that problem. I remember after eating a big meal being hungry, or thinking I was, and standing in the refrigerator looking for something to eat, not knowing what I wanted. And now that once you nutrify your body, you don't really need to eat that much anymore.
Yeah, you're eating like a little canary now. You don't eat like a wolf like you used to.
That's right.
Okay. And what if you had to recommend one book to our listeners that would help them kind of get a grip on it? I mean, we're talking about a lot of stuff here, not necessarily product, but a lot of problems. So what book do you like the best? Because you've been with me for 26 years now. What book would you recommend to our listeners to where they can really get their finger on the pulse of what's going on and how to help themselves and people they love?
Well, probably the easiest book would be to start with would be the Let's Play Doctor book.
Okay, Let's Play Doctor book. Absolutely, because it tells you how to do your own lab test. You can go to a pharmacy without a prescription, get all the same test strips doctors will use. And doctors are the third leading cause of death, kill 251,000. That's 251,000 people every year just from simple mistakes. And that was from Johns Hopkins. They kill, injure, and infect 15 million people in their workplace every year. According to the Center for Disease Control, they kill, injure, and infect 15 million people. Okay? So guess what? Let's do it ourselves. And thank you so much, Shar. Welcome back to the family. Thank you, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
In recent years, several studies have discovered the healthy benefits of drinking coffee. Youngevity has now taken it a step further with an entire product line of healthy coffees from Youngevity's Java Fit line of top-shelf gourmet coffees. All Java Fit coffees are made from 100% hand-selected Arabica coffee beans grown in the finest regions of Latin America, all carefully roasted, creating a delicious, rich, full-bodied flavor. Try Java Fit Impact, a wonderful coffee enriched with 14 beneficial mushroom extracts designed to activate your body's natural ability to heal, detoxify, and energize. This organic and fair trade coffee is available in 30-count single cup or 24-count single pot packs. Contact your local FDI Youngevity distributor to get Javalution coffees. And don't forget to ask about home-based business opportunities. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3600. 314-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the whey shakes again, the chocolate whey shake. And you need to remember, the whey shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.